So welcome to the first ever live stream of the Public Health Insight podcast. My name is Gordon, and I'll be your host for this episode, along with fellow co-hosts Will, Linda, LaShawn, and the special guest that you see on your screen there, the one and only Dr. Greg Martin. So Dr. Greg Martin is a medical doctor working as a specialist in public health medicine for the Health Service Executive in Ireland. And before moving to Ireland, he worked in the global health space in various roles, such as the Director of Elimination of Mother-to-Child Transmission of HIV at the Clinton Health Access Initiative, and the Head of Science and Research at the World Cancer Research Fund. In addition to his current role at HSE, Dr. Martin is currently the Editor-in-Chief of the Academic Journal of Globalization and Health, and holds an honorary associate professorship at Trinity College Dublin. He is also on the board of directors for WILOLA and the Irish Forum for Global Health. So Dr. Greg Martin would like to welcome you to the Public Health Insight podcast.
Welcome.
Welcome. Thanks very much.
Welcome.
Awesome.
And a big apology for me for having gotten things off to a slightly late start. That was entirely my fault. So
We're glad to have you, and I'm sure there will be a lot of valuable lessons coming from our conversation.
For sure. So once again, thank you, Dr. Martin, for joining us. And given that this is our first ever live video podcast episode, we'd like to welcome our live audience here. And so this is meant to be an interactive experience. So we encourage you, like I mentioned in the chat box, to enter your name, introduce yourself, maybe a fun fact, and tell us what region or country that you're joining from. And from what I see already, we could see individuals from all around the world, which is super exciting to hear your thoughts and perspectives and questions. So throughout this discussion, feel free to insert any questions in the chat box, and we'll try to get through as many as we can in between the various topics that we have scheduled. So there's also an option, a cool option actually, where you can actually do a live call-in. And so there should be a button displayed at the bottom of your screen or towards the middle. But when you use this feature, you wait until the end of each of our topic area. And of course, we will let you know when it's time and there's an opportunity for you to call in. And this is a really cool opportunity for your voice to be included in our podcast episode when it's released in the future. So thank you everyone for joining, and we're set to begin.
Awesome. So like I mentioned, for those in the audience just joining us, Dr. Greg Martin is a seasoned public health and global health expert. I first learned about him a number of years ago through his insightful YouTube videos. I think he was the only one doing it at the time, and still is one of very few still doing it. His YouTube channel has almost 100,000 subscribers and almost 5 million total views. And I highly recommend for those in the audience who aren't familiar with his YouTube channel, go and check it out for some amazing content that he does. We've had the honor of being able to invite him to this podcast episode to pick his brain about a variety of topics that I'm sure everyone's interested in, such as pursuing a public health education or global health education, what careers are out there in the field of public health and global health, what are some of those core skills and competencies that are required for you to be a good global health or public health practitioner, and how to start identifying your area of interest in public health. And there will also be opportunities for you to ask questions directly. So, Dr. Martin, before we begin getting into the weeds, I'm hoping that you could just tell us a little bit about how you became interested in both medicine and ultimately public health, and how did you merge them together?
Okay, thanks. Well, anyway, listen, as I said before, great to be here. I'm really, really impressed with what you're doing. You're not only doing a podcast, but you are doing a great job of it. I mean, you're knocking it out the park. It's an absolute fantastic enterprise that you've got going here, so very impressed.
Thank you.
So I'll be quite brief so that we can have lots of back and forth. So I'm going to try and not waffle on too much on any of the issues. And if you want to dig deeper, just push me, and I'll dig a bit deeper. But my interest in public health, I studied medicine in South Africa, And while working as a junior doctor, I stumbled into a job that had a very a big research component. And at the time, this was when the HIV epidemic, or pandemic in actual fact, was really problematic, particularly in South Africa. South Africa had the highest incidence rate and the highest absolute number of HIV in the world, and it was a country that, despite their, at that point in time, this is the late 1990s, there being the availability of triple therapy, so highly active antiretroviral drugs, they were not being made available to the public in South Africa. And as a research unit that I was connected to, we started advocating very strongly for the use and the access to antiretroviral drugs for people with HIV. And that was the first time, I think, that it occurred to me that the health problems that I was seeing in front of me weren't going to be solved by working harder as a doctor. You know what I mean? Like getting on my stethoscope and doing longer hours wasn't the solution. There was a systemic solution. There was a problem we needed to advocate for. We needed to fix something in the system. And by doing that, many, many more lives would be saved than my time spent in a clinic with a stethoscope working away, seeing patients one at a time. And so that was my first awakening to the fact that you could address health problems at a population level. Well, I mean, the notion, I obviously understood that was, conceptually I knew that was the case, but this was, the reality of it dawned on me, let's just say. I had that awakening of, okay, like this is what public health is. You know, you kind of like solve problems kind of upstream. And I was fortunate to get support to do an MPH in London, and that was the beginning of my. And I didn't have a plan at that point, by the way. I sort of thought I want to do public health with no real sense of what that would mean, where it would go. I just sort of thought that's where I'm going, and let me take that next step and get some education. And that was the beginnings. Yeah.
Awesome. So I guess piggybacking off that, then, you know, you currently work as a specialist in public health medicine. So you might not have had a plan at the time, but you are where you are now. So what is your day-to-day look in your current role? Now that you can talk about pre-COVID and now that we're in COVID.
Okay, I mean that's interesting. So I'll give you, and we can do a deep dive on any one or all of these different, let's call them buckets of sort of as my career has unfolded. But there was a time that I worked as after my MPH as a clinical research fellow, so I had a little bit of exposure to academia, and I considered the idea of pursuing a career in academia. So we can talk about that, what it means, the pros, the cons, what the kind of person you need to be, and what that means. And I think there's some real pluses and some real sort of reality checks you need to keep in mind in terms of a career in academia. Then I worked for a little while in the sort of not-for-profit space. I worked at the World Cancer Research Fund, and I was leading a science team, and that was kind of quite an interesting role. And it was interesting in the sense that it kind of occurred to me that a big part of being effective in public health was learning management skills. So that prompted me to do an MBA, which I don't recommend everybody does because it was kind of almost killed me doing it. But there are ways to get education around management skills without doing an MBA that will really pay dividends in your career, and we can talk about that. I think that there's something useful in that. Then after that, I did some consulting work just as an individual independent consultant. Again, a super interesting idea if you're stuck for, like, where do I go, what do I do next? It's a very easy thing to pick up. There's loads of consulting work out there. People often think that there isn't work out there because they're not quite sure where to look, but I can talk about how to find that consulting work. There's lots of it. But again, there's pluses and minuses, and we can get into the weeds on that. It's a difficult thing to do in the long term, but it's a really nice thing to do for a little while, because consulting work often leads to a job with one of your clients.
Right.
And that was the case with me. So one of my clients was the World Health Organization. I was doing some strategy work with them, and then that turned into, at first it was like, well, will you come in as a consultant, but we need to put you at a desk because we need you physically here. And then it turned into, well, let's actually just give you a short-term contract, and then it's, okay, well, let's turn that into a long-term contract. And jobs at places like the World Health Organization, UNICEF, UNAIDS, all of the kind of UN agencies, often the way in is by doing consulting work first. Very few people end up working at the WHO just by applying to a job cold
Right.
and interviewing and getting the job. And like just a little, so for example, I worked at the WHO for 2 years, and I don't think I met a single person there who got their job just by applying to it online, you know, and being interviewed and getting the job. Everybody kind of stepped into it in a kind of higgledy-piggledy roundabout way.
Right.
And maybe the world shouldn't be like that. You know, for a lot of there's a strong argument to say that it shouldn't be like that, but it is. So, you know, we just kind of need to roll with the reality that we've got in front of us. So, and I can talk a little bit about that. So you can ask me some questions about working in the WHO system or the UN system. There's some huge pluses, and there's also some real, again, there's some real reality checks, especially about, you know, if you move to a city like Geneva, there's a couple of things you need to think about. Then I worked as the director of elimination of mother-to-child transmission of HIV at the Clinton Health Access Initiative, and that was kind of my first step into kind of a very senior role, and that kind of global health role where you're traveling all the time. So I was like getting on a flight, flying into Africa, bouncing around Africa for 3 days a week, going back, flying back into Europe, sleeping for a night or two, going back. It was just like I lived in airports. And so we need to talk about that because it sounds exciting, and it's kind of is exciting for a couple of months, and then after a while you become a fraction of a human being. You're losing weight and you think you've got anemia from some, you know. So you need to think about when in your life you can pour yourself into that kind of work.
Right.
You know,
Right. And I guess it depends
depends
too on your family situation as well, and a lot of stuff.
Yeah.
But I wanted to hone in on something you mentioned too, the whole academia versus, you know, practice. So one of the questions we had here was, you know, there's, you know, you can do a PhD, for example, later down the road that has a focus on a public health area, or you can do a DrPH. So I was wondering if you could speak to what are the similarities there and where they start to diverge. I think even for me, that's something that I'm looking into, and it'd be helpful to know.
Yeah, that's a great question. So if you've got your eye on long-term academia, you want to work in a university, you want to apply for academic grants to do research, then you've got to do a PhD. Now, you can start an academic career without a PhD, which is what I did. I worked as a clinical research fellow at the London School of Hygiene and Tropical Medicine for 2 years. But it becomes very apparent very quickly that to progress in that world without a PhD would be extremely, extremely difficult. It can be done, and in my case, I had a medical degree, so there was a little bit of, you know, you could probably kind of progress a little bit and kind of wangle that. But ultimately, at some point in time, and I was told this by people in academia, look, if you really want to take this further and you want a career in the space, like doing a PhD is going to be a must. And that's a huge, so there's a couple of things to think about there. A PhD is a big time sink, so there's an opportunity cost. So you really got to want to do it. I mean, don't do a PhD because you sort of were stuck for, you weren't quite sure what to do next, and it seemed like something you could do. Right. It's a huge commitment. And people that I know that have done PhDs, I mean, it's really, you pour your heart and soul, and you really pour your heart and soul into kind of one thing for 4 years. You know, you kind of like digging deep. You're laser focused on a very, very specific research question. And so you pop out the other side very much kind of with a very specialist knowledge. And we can talk, that's something else we should talk about a little bit, is that being a generalist versus a specialist.
Right.
Because there's definitely different career paths there, and there's pluses and minuses. But suffice to say, if you want to go into academia, you've got to do a PhD. And if you're doing a PhD, just be clear that that's the route that you know, be sure that that's what you're wanting to do, that academia is like kind of where this is taking you. To imagine that a PhD is a good stepping stone into, you can use a PhD as a stepping stone into a public health career in general, but that's a huge time commitment for very little additional benefit. In other words, like when you're applying for jobs, they very seldom are asking for a PhD. That, you know, like an MPH is often entry level, so you'll often see in job adverts, we're looking for somebody with a MPH or equivalent.
Right.
And so I always say to people, don't worry about exactly what type of master's degree you do. Nobody really minds that much. You know, if you did an MSc in epidemiology or an MPH or an MSc in public health, like nobody's going to be looking at your CV thinking, oh my God, he did the wrong kind of MPH. You know, that doesn't matter. If you did a master's level something public healthy, most people are kind of okay with that. And they're not. They may be looking for a PhD graduate if they're employing somebody that's going to be a super focused policy wonk on a very laser focused issue. Right. And in which case, they're wanting someone that did a PhD in exactly that thing.
Right.
You know what I mean? So having a PhD doesn't make you qualified for that job. They want the guy that spent 4 years on that thing.
Right.
So you've either done a PhD in exactly, just by chance done a PhD on exactly the right topic to be the sort of policy wonk that they're wanting to hire for that exact thing, or you're out of the game. In other words, like your chances are best like in academia, where having the PhD kind of qualifies you to do postdoctoral work and to apply for all sorts of grants, and you know, you can branch out from your subject matter once you're in that academic environment. But the thing about academia, and I'm going to get back to your question because it's a good one. The thing about academia, just to kind of finish the circle on like the PhD route. The pluses of academia is this: it's a lovely lifestyle. It's you spending a lot of time thinking and being intellectual and pontificating about the world around you, and that, you know, that's really nice. If you like teaching, it's great. You can do a bit of teaching. So it's a nice lifestyle. I think it's kind of the hours that you work are nice. It's a relatively low pressure environment. In other words, there are pressures to like get grants, to get money for your research, and that's not easy. But on a day-to-day basis, you're not typically. And I'll give you an example. I mean, in my job, I'm put in front of the press sometimes. I did a press briefing the other day, and I had like cameras on me and reporters asking me questions, and sometimes asking me questions I didn't know the answer to, and my dumb answers got into the press this week. You know what I mean? You don't get that really in academia. You know, they kind of got a little bit more breathing room. And okay, the downside of academia is this: people go into academia and often imagine that once you've got your PhD, you will be able to sit back and think about all the interesting questions you'd like to answer. Use your imagination. Be creative. Think of these very interesting questions, and then spend your career designing research projects and answering those questions. And some people do have that, but most people don't. The way it usually works is the funders, so the Wellcome Trust or Gates Foundation or somebody, put out a call for expressions of interest on what they want researched. And then you've got a whole lot of university PhD graduates competing with one another to get that grant. In other words, you're not always doing the research that you want to do. You're doing the research that a grant-making organization wants done, and you're kind of almost working for them in a funny kind of way. Now, keeping in mind, you're going to be applying for grants in an area that you've already got an interest in. So it's not that there's no overlap with your interest, but the point is, there's very few grant-making organizations out there that have just sort of said, here's a big bucket of money, and if you come up with an interesting question, we'll just give you the money to do the research. There's a little bit of that. I'm not saying it doesn't exist, but you know, usually it's the other way around. Usually the people with the money are the people deciding on what questions they want answered, and they're getting everybody to run around and compete for that money. So you've got to keep that in mind. You might not land up doing... The other thing about doing a PhD is very often PhD candidates land up doing research that's really the research interest of their supervisor. So even doing the PhD itself, you're going to spend 4 years answering a question that might not even be your question. It's like, you know, you've got a supervisor, and but like, I'm painting a bit of a bleak picture. I know a lot of people working in academia that are very, very happy, and it's a nice lifestyle. So, you know, don't knock it, but just keep an open mind. By contrast, a DrPH it's a very high level of education. You are learning super duper hardcore research skills, but you're also getting plugged into usually an organization where you do a practical, and you spend some time really in the practice of public health. And so it's with a view to turning you into a public health practitioner. You can go the academic route with a DrPH, so you're actually opening up a lot of doors. You can use a DrPH to launch into academia, or you can kind of focus yourself in on practical you know, the practical application of research. And very often what you'll do in your DrPH is you'll design a research project around a problem that really exists in the organization that you've stapled yourself onto. And that will because you're doing research that really translates into valuable outputs that the organization and other organizations like it would find useful, it's often a very easy stepping stone into a career in that space.
Right.
So DrPH, if you're not sure that you want to stay in academia, it's a lovely a launch pad into the practice of public health potentially.
Interesting.
Awesome.
So is it
Yeah.
is it that?
Long answer. Sorry, I said I'd be brief. And
No, we're glad that you. I'm wondering then for the DrPH, I guess, is tied to an organization's work, whereas a PhD is more tied to an academic institution's research mandate, based on a specific area that the PhD candidate is focused on. Am I getting that
Yeah.
correct?
Yep, that's it. That's
Awesome.
pretty much right. Yeah.
Interesting. Yeah, so I guess another thing, and keeping in mind that in this live chat we have a lot of individuals maybe pursuing a bachelor's of public health, or currently doing a master's of public health, or currently finishing or just completely finished a master's of public health. A lot of individuals or students are either searching for jobs in the context of COVID-19, or they're trying to pursue further education in public health. Sure, we mentioned the PhD, the DrPH, but interestingly, you mentioned your MBA. Is there any sort of other combination of degrees that could help elevate your skill set or toolkit in public health that may be interesting to consider?
Yeah, so I think that's a really interesting kind of it's an interesting question, because you're sort of asking, like, look, in lieu of me actually having a job right now, what can I do to kind of add to my value proposition so that I'm more attractive to employers, or what? So something that you kind of need to figure out at some point in your career, and the reason why I was a little bit hesitant as I said those words is because I'm not sure that I've figured this out myself. I often ask, like, I kind of think, well, what do I want to do when I grow up? And I haven't got that completely nailed down. But this brings to my mind, this kind of begs the question of being a generalist or a specialist. And do I want to develop skill sets that are general skill sets that are transferable and can be used in multiple different contexts? Or do I want to become a subject matter expert and really dig deep on something that I'm passionate about? And that's not an easy question to answer. And in my case, I'm not even sure if I know the answer myself. Like I've spent a lot of my career working in the HIV space, but that was, I didn't really plan that. I kind of stumbled into that. And let me put a little bit of flesh on the bones of those issues. If you hunker down on a very, very focused area of interest, and that area of interest might be a disease area or an area of exposure, or it could be a certain population group. You might be interested in refugees, or disenfranchised people. It might be human rights. It could be climate change and health. So there's a range of things that it could be. But you kind of like take a topic and you say I'm going to become like a world-leading expert in this space. The advantage of doing that is it's easier than you think to really get on top of a subject matter. Like if you want to become like a world-leading voice in a very focused area, that's not that difficult if you stay laser-focused on one thing. And you can progress quite quickly because you can it's not difficult to kind of become known as somebody that knows a lot about something. The downside of that is that you're likely to kind of box yourself into that, and you need to be prepared to kind of do that for the next, the rest of your career. Not necessarily, but it becomes difficult to kind of swap over onto something else. So if you super duper focused on a particular area, sometimes it can be difficult to break out. Now, there's exceptions to that. Like I've seen people, a good friend of mine spent 20 years doing HIV research, and recently he phoned me up and he sort of said, look, when we finished medical school, HIV was the big thing. But now the big challenge facing humanity is climate change and health, and I'm making a change. I'm going to swap over from HIV to climate change. And I kind of was a little bit startled, and I was like, Matthew, dude, that's kind of quite brave, because you're now competing with other people that have been working in climate change for 20 years, and you hardly know how to tell what the weather's looking like. What are you doing? But he was quite smart about it, so he started off getting his first grants looking at the effect of climate change on things that overlapped with HIV. So he used the fact that he had an HIV background as the platform of his expertise to get the grants, and he's taken it from there, and he's done quite nice. But that's exceptional. I think people struggle to make that change. The other scenario is you become a generalist, right? So you do a little bit of what I did, which I enjoyed, but I'll tell you why it's difficult sometimes. So you can go out and you can do an MBA or something. Like an MBA is kind of was a bit much, I think. It's kicking in, it's becoming useful now, to be honest, at this stage in my career, but it was a huge undertaking. You can do shorter kind of diplomas in management or things, just get that skill set, get that general, how do I get things done skill set. And you become a generalist, and you kind of keep a broad sense of epidemiology, and you kind of have a sense of what's happening in public health along a lot of streams. And that's useful, but you keep in mind that when you're applying for a job, that job is usually in some subject matter where you're competing with the guy next to you who went the other route and became a subject matter expert and has been doing that thing for 20 years. And so you really got to make a strong case for yourself in that job interview that despite the fact that there's definitely people out there that have much more technical knowledge about the subject, I'm your guy because I can get things done. That's you got to make that argument, and you got to make it strong. And I literally say that in interviews. I use those words. I literally say, I will get things done. You know what I mean?
Do you give us permission to use your words too in interviews?
Sorry?
Do we have your permission to use your words in our interviews as
You're
well?
welcome to. Yeah. I'll tell you a couple of things that I do in interviews if you want to know.
Oh,
Now,
absolutely.
I don't know if they're good or bad, but I'll tell you what I do. Should we do a quick tangent on interviews?
Yes.
Go ahead.
Okay, just a couple of things while I'm thinking about it. The first thing is, I won't talk long about interviews, we can come back to this, but the first thing is this. In the beginning of most interviews, they ask you like a softball question just to get the ball rolling. And it might be like, oh, tell us about yourself, or like just walk us through your CV, or just, they're just kind of giving you. Now, there's an opportunity there to hijack that question. In other words, ignore the question. They say when you're speaking to reporters, like, don't accept the premise of the question. Give them an answer that you want to give them.
Right.
You've got something prepared that you're going to give, no matter what they ask in that first question. Now, obviously, you want to be polite, so you don't want to just kind of ignore what they've said. You want to just sort of. So what I often try to say in the beginning of an interview, almost no matter what the first question is I say, look, what I want to talk about. And I hope this answer kind of addresses what you're asking, is I just want to talk a little bit about what I think is really going to be needed in the job that's been advertised, and how it is that the experience I've got and the skill sets that I have are going to contribute to that, or how I'm going to add value, or what my sort of value proposition is. So I just bring it back to like, this is who I am, this is what you're looking for, and I think there's a good match there. And even those words, I sometimes say that. You know what I mean? I think this is what you're looking for, and I think that's me. And people don't mind you saying that. They that's kind of the question they're trying to answer. Like, is this the right guy? And you get to say, like, yes, I am. I'm the right guy. And I've sometimes said that and not gotten the job. So you've got to live with that as well.
Grain of salt.
But I will often. So if they said to you, walk me through your CV, I don't do a chronological. Okay, I finished medical school, and then I did this, and then I did that, and then I did this. They can read that on your CV. I say to them, look, the things that I think you need in this job are good, depending on what the job is, but I might say, I think you're needing good leadership and good management skills in this particular role. And the experience I've had in terms of leadership, and then I usually break that down. And I say, like, I want to just talk a little bit about like leadership in terms of, strategic leadership, and then, you talk a little bit about that. And there's different kinds of leadership, different kinds of management. I won't get into it in this conversation, but I break it down a little bit, and I say, this is the experience that I have that I think will be useful in this particular role. So I never walk through my CV chronologically, because I don't think that's useful. Like, I extract out the skills that I really want to talk about, and I bring that into that first question. And I do the same thing right at the end. So at the end, they say to you in an interview, do you have any questions? They always say that. I don't have any questions. I say to them, I don't have a question, but I'd like to give you a closing statement. And then I tell you what you put into this closing statement. You tell them, look, because they've heard all about what you can do and your skills, and they don't need to hear that again. But what they don't know yet, and you got to tell them this, because this is where you leave them with the impression. You say to them this. You say, look, I'm hardworking, and I'm easy to work with. I'm a nice guy. I get on well with my colleagues. You know what I mean?
Soft skills,
Like,
yeah.
say something about, just talk about those two things. Like, I'm really hardworking, and I'm passionate about this, and tell them I really get on well with the people that I work with. I'll tell you why you want to say that. They're sitting across the desk, or nowadays across the Zoom call or whatever, and they think to themselves, when I get to work on Mondays, do I want to work with this guy or
Right.
this woman? That's what they're thinking.
Very
They're thinking
true.
like,
Yeah.
like, I'm going to spend time, especially if the person on the other side is the hiring manager. They're thinking, do I want to work with this person? Do I? And if you just say to them, look, I get on well with the people I work with. I'm easy to work with. That's like a big tick. They're thinking, yeah, I do want to work with Greg. He's a nice guy. He's dead right. You know what I mean? So that wasn't on their list.
Yeah.
That wasn't on their competency list. But that's a huge tick, and nobody says it in an interview. And why not? Why not just say it?
Yeah.
How are they supposed to know that? Just tell them. I'm a nice guy. I get on well with the people I work with. I enjoy work. I get to work. I've got a positive attitude. Just say it.
No, for sure.
It means a lot, and it's not. You know, we go into interviews thinking tick box, tick box, tick box. I want to tell them that I can do this, I can do that, I can add up numbers, I can spell. Don't just tell them I'm a nice guy. I get on well. I work hard. You know, I've got a positive attitude. Say these things, and it means a lot. The other thing I'll tell you about during the interview, if they are, usually have an example or two for every kind of competency that you think they're going to ask around.
Yes.
And then explain that this is what I did, and this is how I think that skill relates to the job you're advertising. Show them that you know what is expected of you in the job.
Right.
So, if it, you know, so I've demonstrated the skill. I'm good at statistical analysis, and I did a thing, and we drew a graph. And in this job, I think that's important because a big part of what you're doing is M&E, and I'm going to be able to apply myself to that.
Right.
So join those dots between what I can do and what I know is important for this job, and do that with every single question. And that's a very strong interview.
For
Okay,
sure.
that's enough.
Wow.
I've gone on a tangent. You might have to rein me in because I can.
No.
No.
You know what? That's fantastic, and we've been getting quite a few messages saying that this is amazing and this is great information. So thank you for sharing that. But at this point, we'd love to take the audience questions. So feel free to type your questions regarding anything that was just talked about in the chat, or if you're brave, we can you can start a live call in. And we can have you on here. You don't have to go on video, but we can hear your audio, and you can ask the question live. So
Ask
we'll
him
give
yourself.
it a few.
Ask him yourself.
Yeah, we'll give you a few moments for that. And we got a comment from Janelle here saying, "Very true. You can teach skills, but you cannot teach personality." In relation to your comment about highlighting the soft skills, you're easy to work with, you're a fun guy. So. That's
was
fantastic.
that a question or a statement?
That was a statement. That was just a comment.
Yes. So while people, we'll give it a minute or two for people to conjure up the courage or to call in or put some questions in. But we had
don't bite.
we had a question in the meantime that maybe you can, before we transition to the next theme, from Jenny, asking about if doing a DrPH is more beneficial for students coming from other master's degrees. And do you think that there is any benefit for MPH students, transitioning and doing a DrPH?
Okay, I mean, super good question. Really, really interesting. And it's not often that I get asked a question that I haven't been asked before. So I've never been asked that before. Because I talk about this quite a lot. So right, if you're coming from a different field, okay, let's row back a little bit. I think there's a role for public health for people from all sorts of walks of life.
Mm-hmm.
Right? If you're an engineer, we've got engineering problems. We want to get clean water to people, blah, blah, blah. There's all sorts of things. There's almost nothing, if you're a mathematician, oh my goodness, we could use mathematicians. If you're, there's very few walks of life that I wouldn't be able to think of like a role for you in public health in some shape or form. So there's definitely going to be people out there who have done a master's degree in something completely unrelated. And but they're thinking that they'd like to step into public health. And I don't know what the acceptance criteria are or aren't for DrPHs. But if you could step in from one of those other disciplines and step straight into a DrPH program, and I don't know if the person asking the question was alluding to that, but then I would really recommend it. That is a really nice transition into public health, and you'd be setting yourself up for like a very interesting career because you'd be bringing a beautiful, delicious kind of combination of skill sets. which would be, you would be a rare asset. You'd be extremely valuable. So that's interesting. The second part of that question was, well, if I have an MPH, how much sort of additional value is there in terms of doing a DrPH? And I suppose you need to weigh up the opportunity cost. So how long is a DrPH going to take you, and what might I have done with that time otherwise?
Right.
But DrPH is quite practical, so you're not wasting time. There's an expense, so can you afford it? I mean, maybe you can get a scholarship, and if you can get a scholarship and you're young and you've got the time, and you're not in a hurry, it's not going to do you any harm to do a DrPH. But I don't think people need to feel that they need a DrPH.
Right.
If you've got an MPH, and you're not thinking of academia as a career choice, then you're set in terms of education.
Right.
Then you want to start thinking about skills and experience, and you're good to go. There's nothing wrong with getting additional education,
right?
And and I did, but you honestly, now there's exceptions to that. For example, I'm working in Ireland. If you want to work in a country and you want to get deep into the public health system, and you're a medical doctor, medical doctors often in most countries have the option of specializing in public health,
right?
And that's a whole. And I've done that here in Ireland.
Right.
And I came to Ireland without having done that. So I'd been working in public health, came to Ireland because I married an Irish lass, and found it was very difficult for me to get into the system without going through the specialist training. That's the route in. That was you needed to tick that box. And that was not an easy thing for me because it was 4 years of going back and being like effectively a student and doing exams, and this is in my 40s. So that was a bit of a bitter pill to swallow. But I did it, and and it's gotten me in the system, and so now I don't need to worry about that now. But that is so for people that are medical doctors and they're thinking about public health, then doing the SPR, the specialist training in public health, if you know that that's the country you're going to live in and work in. Isn't a bad idea because it opens up all sorts of doors and opportunities. But so if there are people that are listening that are medical doctors in public health and they're wondering, should I do this specialist training in public health? It's actually not a bad idea because you're getting paid, right? So
right.
You're getting training, but at the same time you're getting a salary, you're getting paid, and then most of them will pay for you to do an MPH. So like you're actually getting a salary while you're doing it. It's a really sweet deal. So those are the. Sorry, the question was. Okay, I think I've answered the question.
I think you have. Yeah, and and transitioning from that. So there's a public health education. You get your public health degree or global health degree. You're proud of yourself. Your family's proud of you. Your friends are happy. And now it's time for you to start thinking about what are you going to do after, jobs, careers. So we know that you have a lot of experience in the global health space and public health as well. So what is the first steps when someone has finished their education and starts looking at, employers, areas of interest, that sort of thing?
Okay, so one of the most common questions that people ask as they're finishing an MPH is, how do I get that first job? Because most of the jobs ask for experience, and how do I get the experience without the job? It's that chicken and egg problem.
Yeah.
And everybody kind of has that. And it's actually not easy. I understand that it's difficult. There's a couple of things that you can do around that. Firstly, if you take you guys, for example, you're doing something outside of the context of formal employment. You've started a podcast. And there's lots of things like that people can do. That you can clock that up as experience. You know what I mean? So when you guys are applying for jobs, you can say, like, I did a public health podcast for X number of years and managed it, and we had a team and we did stuff, and there was logistics, and we had all sorts of operational issues, and you can really talk about what you've done, and you didn't need, you didn't have to get employed. You guys started this. And I think, so the one thing I'd encourage people to do is do what you can outside of the context of formal employment in terms of clocking up any kind of experience. And you could start a blog. You can, I was once hiring someone to join my team when I was working at the WHO, and there was a couple of candidates, and they all seemed very good. But the one person had, in their own time, started like a whole web page looking at access to medicines and that sort of thing, which is the work we were looking at. And I was like, well, this person's demonstrating like a deep interest in this in a personal way. Like this is her spare time that she's using to kind of get this web page up. So this is more than just a job to this person. And so we gave the role to her. So doing the sort of thing that you're doing right now actually matters. It adds up. I mean, it matters in terms of you having a great impact and you're doing a good thing, but it matters in terms of your own careers. This is experience that will really reflect well on you going forward, believe me. And I did a similar thing. I started the journal Globalization and Health, and when I apply for jobs, people sometimes have seen the YouTube channel. They ask me about it. So it's these things land up being useful for having done. Okay, that's the one thing. The second thing you can do is, and this depends on the extent to which you can afford to do some work without getting paid, but you can do some volunteer work, and that might translate into other opportunities. Increasingly, there are internships that you can do that you get paid for. So you can do an internship, for example, at the WHO. Now, WHO internships didn't used to get paid. And I found that quite objectionable, and a few of us actually wrote kind of a sternly worded letter saying that this is ridiculous, because what it meant was internships at the WHO only were filled, those positions were only filled by people that came from wealthy families that could afford to send their children to live in Geneva, a very, very expensive city, for 3 to 6 months. And if you were from a low middle income country, there was, and didn't have that kind of resource, there's no ways you could do that. And what is the point? Like the WHO should be having interns from all over the world going back into their countries, strengthening those relationships and interconnections. So now the WHO does provide a stipend, and I think it's quite a healthy one. So, and like UNICEF would do the same, the World Bank probably the same. So a lot of those bigger organizations would provide paid internships. So that's something else that you can do. And the final thing you can do in terms of getting experience without getting a job is you can do consulting work. And I talked about consulting work a little bit earlier, and I'll just circle back on that quickly now. There's probably more consulting work opportunities out there than you would think, but people find it difficult to know how to find the consulting work. And believe it or not, people on the other end of that equation find it difficult to find the consultants. It's weird. But I mean, when I was wanting to do consulting work, I was like, I don't know where to start looking. Where do you even start looking for consulting work? And I remember when I was working at the WHO, people were like, we need consultants. Where do we find them? We don't know where to find them. So there's almost like a dating game that needs to happen. Like swipe left. All of the swiping.
Tinder, let's go.
We need that.
I don't
Match
even
it
know how
up.
the swiping story works. It didn't exist when I was young and single. But I think whatever you guys, young people, do with the swiping on the phones, we need to do that with consultants and consultant vacancies. And I've been talking about this for years. We need to create like a dating website. Because on both sides of the equation, everybody's looking for them, but it's just that conversation's not being facilitated. There's no one's helping these people talk to each other. But there's certainly, like if you're a good consultant at the WHO, your CV gets emailed around left, right, and center. Like people are hungry for good consultants. The other thing to keep in mind about consulting work is people often think, oh, consulting work, and they think of strategy consulting, like McKinsey and Company, like they'd swoop in and give you a 10-year strategy. Most consulting work is like bread and butter work that just the organization needs some horsepower. Somebody's gone on leave or left the organization and there's a gap and they need somebody to help. They need an extra pair of hands. They don't need you to be a super-duper expert. They just need a human being that's bright, that can engage and quickly get up to speed with what they're doing and help them get something over the line. And there's lots of that kind of work out there. Now, how do you get it? You've got to network like crazy. Okay, at the moment, like in lieu of the dating service that we put together. The way to do it is you've got to network like crazy. And how do you do that? Use things like LinkedIn, email people that you know, work through academia, your professors, ask them if they know somebody that works at the place you want to work. And then you kind of have to do a little bit of cyber stalking. Okay, this is what I mean by that. I'll give you an example. There was someone when I was at years ago, there was somebody that I wanted to get in touch with. I saw this person as a contact that I may want to talk to about career opportunities. So I looked up a paper that he had written, and very often the corresponding author's email address is available. So, okay, so this is there's a little bit of stalking here, but like, okay, now I know I can get in front of this person. I can get into their inbox, right? Now, you can get into someone's inbox and you can either be annoying or you can get their attention. So this is how you get their attention. Firstly, the email you send, super short, like super short, like so short that they need to be able to read the entire thing at a glance. Because, like, and I'll tell you why I'm saying this. I get people that sort of find me online and they'll find my email address and they'll send me an email about, you know, they're looking for a work in global health. And more often than not, their email is like a 3-page long description of their entire childhood and why this is important to them and they're going to be the best person ever. And can I tell you something about my inbox at the moment?
Go.
I have a person that manages my inbox. I don't even read my emails anymore. I've got a human being that reads all of my emails and fishes out the stuff that I have to see, because if at the end of the day, if I haven't seen it, my world is going to fall apart.
Right.
So somebody from wherever that sent me a 2-page long email about their childhood and how they really want to do this, my executive assistant is not flagging that up for me to read. Just that's because of where my life is at the moment. Like, I'm not reading emails. You know, I've got, and not everybody's in that. Like, that's just because my life at the moment is kind of totally mad, and that's COVID related. But even if it wasn't that mad, let's say I was back in my normal life where I'm actually reading my emails, I'm still not wanting to read 2 or 3 pages from some person that I've never met before, especially if I'm getting quite a few of those emails. You send a very short email, I'm going to read it, right? Then what needs to be in that email? That email has got to have a question, because then you're asking me to send an answer. And the question, you want to find a question that's got a short and easy answer, not like, can you please explain to me how to get a job in global health? Well, that's a whole conversation. And sometimes I actually had someone recently reach out to me through LinkedIn, and they had some quite detailed questions, but I could see that thought about this quite a lot. And I sent a reply, and I said, the answer to that is too complicated to put into a message, but let's talk on the phone and we'll kick this around over the phone. And this afternoon, I spent an hour on the phone with that person. And I'm never going to see them again in my life. And so people will make the time for you if you come up with a good question. So you want to send a short question. Now, this is what you can do. You've read a paper that they've written. You can ask them a question about something they researched. So don't be saying, have you got a job for me? Like, chances are at that point in time, on that day, they probably don't have a job for you. You want to build up that relationship. So you want to say, I read a paper that you wrote, it was really interesting, and I just had a question about one of your research findings. Here's the question. Bam. You know, kind regards, blah, 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 blah. They read that question, they're flattered. Hey, this person read my paper. And they were interested, and they asked, like, of course I'm going to answer that. You know, beep, 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 here's the answer. Now suddenly, you're email buddies. You know what I mean? You weren't annoying, you weren't asking them for a job, you weren't sending a 3-page thing. Short, quick email, and they sent it back. And then leave them alone for a while. Like, don't reply back. Don't try and become pen pals. Just like, now we're in contact. Then, like, in 6 months' time, you send another, follow-up. Hey, how you doing? Just wanted to keep in touch. You know, I read another paper that you wrote. I was really impressed. Would you be interested in collaborating on something? Or, you know? And you don't just do that with one person. You go wild. Like, email loads of people like that and build up that professional network.
So important.
In those conversations, you can mention, listen, by the way, I'm available to do consulting work at the moment if you know of anything that's out there. So that you can just slot that in there. And you'll be surprised, So the consulting work. Okay, the reason why consulting work is quite a nice thing to get into if you don't have a job and you're kind of like, well, what am I going to do? I'm kind of stuck for something to do. If you say, I'm doing consulting work, even if you don't get much work, but you did it for 6 months, and even in that 6 months, you only found a few little jobs here and there, and most of the time you were kind of like searching around, stalking people on the internet. Don't worry. Because that means when you apply for the next job and they say, what have you been doing? You're being like, well, I spent 6 months doing consulting work. So you weren't doing nothing. You know, you're building up your CV, even if you're doing small pieces of work and you weren't making a fortune in this, you know. So the consulting work, if you do get into that space, very often will lead to a job. So it's often a great stepping stone into an organization.
Very
Again, was a very long
interesting.
answer. Sorry, Alex.
No, that's totally fine. And before I follow up to that, for the audience, feel free again. This is your opportunity to ask more questions about anything that was just mentioned. And we're still waiting for someone to be brave and come on to the live call with us. It'll be short. You can just answer, or read your question out, and then we can answer it. But to follow up on your comments, Greg, about kind of how to approach an email situation of jobs you're interested in and reaching out to your network, you mentioned that you would prefer it to be as brief as possible, and you talked about that fine-tuned brief question. Do you think that it's important for the individual to also have a couple sentences or a sentence to introduce themselves and where they're at in that kind of email?
Yeah, I would. You create a bit of context, definitely, but like keep it as short as possible, and you can fill in some of the blanks in subsequent emails. But like out of everything about what goes into that email, your number one objective is to find a way of being brief.
Yeah.
Okay, I'm like it's so perhaps take what I'm saying with a slight pinch of salt. So I'm quite badly dyslexic. So for me, long emails are particularly annoying. But like that might not be the case for everybody. So maybe take everything I say about long emails with a slight pinch of salt. Like if I get a long email, it feels like I'm being stabbed in the eye with a pen.
No, for sure. Like I've heard that comment from a lot of people, and I've worked with a lot of supervisors in the past, and they said when students and career seekers are sending out emails and it's just a page long, they don't have the time. Realistically, they have their own jobs and responsibilities at their work. And okay, so we actually have a question from Instagram from C-Day, and this individual is asking, what countries have the best jobs for global health and need the help the most?
Wow. So
Yeah.
there's two sides to that. Most global health organizations have a headquarters somewhere, and so you may want to be working in that environment, or you might be wanting to work in the field at the sort of coalface, and then that's a very different set of countries. Okay, so if you're wanting to work at a headquarters and countries that have got a lot of sort of global health organizations and a big presence would be kind of Geneva, London, Washington, D.C., and then and there's some academic institutions in sort of maybe San Francisco, and there's a couple of, but some of those big cities, but even kind of relatively big cities, like when I moved to Dublin, there wasn't much in terms of, organizations that are involved in global health where, I could look for, because that's what my original plan when I moved to Dublin was. I'll just find a global health job here. And then I just got here and I was like, ooh, hang on. All the organizations that I'm used to working with don't have a presence here. So but certainly like if in Geneva, you can't throw a stone without hitting 4 people working in global health. There's like loads of global health in Geneva. Hundreds of organizations, it's crawling with it. I'll just quickly talk about Geneva while we're talking about location, because jobs in Geneva pay very well, so the salaries are great. It's a very expensive city. There's something about Geneva that is very transient, and everybody that's working there is there for a little while and then moves on, and there's a lot of coming and going. And what that means is that it's not an easy place to feel as if this is home. So depending on where you are in your life, that's an important thing to think about. So I loved my time in Geneva, but at no point while I was working there did I think, I'm going to live here. This is now the place that I live. I always kind of thought, I'm here for a couple of years and then I'm going to move on. So keep that in mind. Depending on where you are in your life, that may be an important issue. You might be wanting to settle down and start a family, and that's important. And the other thing that relates to the question is like kind of, okay, in terms of maybe you want to get really at the coalface of public health and you want to be working in a low and middle income country. Most poor countries have got a huge need. So you could almost look anywhere in the developing world and there's going to be a need for people to kind of get involved. And then it starts depending very much on like what kind of work would you like to get involved with. So you've got organizations like MSF, that'll parachute you into any kind of disaster area, and you know, you working with them, you're probably going to move around a lot. It's a very sort of adrenaline-driven career. I was actually going to work for the International Committee of the Red Cross in conflict zones when I was finishing my MPH. I had a job offer from the ICRC to work in conflict zones, and I'd said yes to the job. And I was going to be moved to the Sudan, and at the time there was civil conflict there. And I woke up one morning and just kind of genuinely felt afraid. Like I thought, I'm going to be going into a very dangerous environment. And then I had this little kind of realization that actually I won't be happy. I won't be comfortable. I'm going to have this feeling. This is how I'm going to feel probably most days when I'm in that working environment. I'm going to feel unsafe. I'm going to feel unwell. And there are people, and there might be people listening to this podcast or watching this live stream that have a very high tolerance of that level of insecurity. I've worked with and met people like that, and they like almost thrive on it. And I just had this realization that wasn't me, and that's okay. You know what I mean? Like I just had to come to terms with I'm not one of these people that can just rush off into a conflict zone and feel okay about it. So I phoned them up, and I said, "Look, I can't take the job. I actually had that realization while I was on Tottenham Court Road in London, shopping for a satellite phone. Like that's how close I was to leaving.
Right.
I was going to get a satellite phone and buy a ticket and go. And I just was like, I can't do this. And funnily enough, that very same day, I got phoned up by the London School of Hygiene, and they offered me a job as a clinical research fellow. And I was like, yes, I'm coming to sign the papers right now. I'll do that. That's what I want to do right now. Sounds safe. So I just kind of took... So you need to kind of think about what it is you want to do in that developing country context, if that's where you want to work. You need to think about where you are in your life. Like, are you at the kind of, I want a picket fence and a tree and a dog and a wife and kids? Because flying around, it's difficult to people do it, by the way. You know, but I think it's hard. It's hard if you want to start a family and you're bouncing around, the field. But there are people that do it, and obviously there's nothing wrong with that. But you got to figure out what works for you.
Thank you, Dr. Martin. I think it's the last point you mentioned about individuals' well-being and how comfortable they feel with the specific career. I think that really resonates a lot with myself, and I'm sure with a lot of our listeners here. Just a really quick question, before we wrap up this segment, in terms of global health careers and just in the global health sphere. So I've often heard, and people have also asked me, and I've never seemed to have the correct answer or even where to begin. It's that looking to eventually, let's say, work in the global health field, how important is it really to have those field experience, or have international experience, or just something along those lines that you're able to, or is that something that will, without it, that will kind of hold you back from a career in global health?
So it won't hold you back if you don't have field experience, because but it depends a lot on exactly what it is your value proposition is in terms of looking for jobs. So let's say, for example, you're wanting to work at the WHO in Geneva. If you're applying for a job as a statistician or a data scientist, that's going to be nobody really minds whether you've been doing stats in the field or not, for example. If you're wanting to work as a health systems expert, particularly with respect to health system strengthening in developing countries, then you absolutely have to have been working in a developing country and seen, health systems and health system development, and been at the coalface in that sense. So it depends a lot on what it is that you're wanting to do, but there are so many jobs in the global health space that you could get at sort of a headquarters level, for which the field experience isn't necessary, that you don't need to feel that I can't work in this space unless I go and spend a few years in the field. the exception to that is if you're wanting to be the sort of person that's going to be your value proposition. Like I'm coming to the table with that field experience, and I've been, working at the coalface in that space, and having had that experience, I can now bring the learning and make a contribution, in this different environment. But it's I think it really, really comes down to the kind of job that you're looking for and the kind of field that you're working in. And if it's the case, I think the reason you don't need to worry about it too much is that the kinds of people that are interested in the sorts of things that require field experience are the same kinds of people that land up getting the field experience, if that makes sense. Like there's definitely like a natural sorting, you know what I mean? Like the kind of person that's like sort of deeply interested in mathematics and statistics and data science and modeling is the kind of person that spends a whole lot of time at like they're just not finding themselves in Rwanda, like but the jobs that they are applying for also aren't requiring that of them. So there's almost like a natural sorting. Like your interests will take you along a path that give you the experience that you need to land up in the place that you're going to find yourself. So people ask that question a lot, but I think if don't go and do field experience because you think you have to in order to get some other kind of job. Go and do field experience. Go work in the field if that's where your passion is, and that will lead you naturally to the kinds of jobs that kind of experience gets you ready for. Does that make sense? So
yeah,
I kind of think do the thing that feels right for you. If you don't really feel comfortable, and it's fine to not feel comfortable. I didn't feel comfortable going to the Sudan, and at the time I actually felt a bit like, oh, is there something wrong with me? Am I not supposed to want to go and do that? But you just come to terms with that. Like it's okay not to be that person. Maybe you've got a family, you want to start a family, or for whatever reason, if you don't feel comfortable going and doing field experience, you're entitled to not be that person. There's still space for you to add value in other ways, and you'll kind of find your space.
Awesome.
Thanks so much.
Awesome. So we have our first live call-in pending here for a question from Purva. She's just looking to hear your thoughts on some changes that we should expect to see in public health and global health going forward, but I'll bring her in for her to ask you herself.
Sure.
So she'll be joining
Sounds
us. Good. Hello, Purva.
Hey, Purva, are you there?
Looks like she's coming in. I see a turning circle on the screen.
Hello, Purva. Can you hear us?
I tell you what we could do. We could start talking about just that, and if she kind of manages to get in, we can get into the weeds on it with her.
Yeah. So her exact question was, what are some of the biggest changes in public health or global health you have seen or expect to see over the next few years that impact the work in the coming years?
Well, I think one of the things that we, COVID-19 has definitely awakened the world to the seriousness of pandemic threat. And the truth be told, and people aren't saying this now, but this is going to have to be a conversation that we have quite soon, and that is that nature threw us a very softball with COVID-19. Like, this could have been so much worse. COVID-19's got a case fatality rate that's way down, in and around 1%, depending on where you are. There are viruses out there that have got a 60% case fatality rate, and we need to come to terms with the fact that, zoonotic outbreaks with pandemic potential is something we need to be much better prepared for going forward. So the one big change we're going to see, I think, is there's going to be a lot of resources poured into pandemic preparedness, that kind of health protection, coordinated responses across different countries, making sure that we've got ourselves kind of, and a lot of what we're doing now in terms of the public health response are going to be consolidated and kept in play going forwards. So, for example, in Ireland, we've put together quite a sophisticated contact tracing mechanism that we didn't have before COVID-19. I'm pretty sure in some shape or form that mechanism will be kept in place. It'll be scaled down, but it'll be ready to kind of scale up if needs be. So there'll be a lot, and that's going to have to be manned. There's going to be resources put in place for that. So that's going to be a big change that we're going to see. That change may have some detrimental effects on other areas of public health because resources will be shuffled from some things into other things. Purva, hi. Don't worry, I struggled to log in as well earlier, so you're not alone.
Yeah, so he was just answering your question there. You mentioned, Dr. Martin, about the contact tracing mechanisms as a result of this pandemic will need to be left somewhat intact, even though it's scaled down. You're mentioning some other things that going forward. So I'll pass it back on to you to finish up your thought.
I'll finish up my thought, and then Purva might have some comments or suggestions or additional thoughts. But I was just saying there's a lot of what we've put in place for COVID-19 that'll have to stay in place because we've got to be ready for pandemics, I think, going forwards. There'll be a lot of resources that are going to be shuffled into pandemic preparedness that weren't there before, and I think, which is a good thing because I think it's a serious threat. The downside of that is that these might be resources that are taken from other streams of work. And we've seen that before. We saw... there was a point in time when there was so much resource being poured into the HIV pandemic that other areas like neglected tropical diseases just remained neglected. And we're still struggling to kind of ensure that there's resources and money and finances put aside and focused on some of these other issues. Non-communicable disease, of course, is important, and that might suffer a little bit with this sort of increasing prioritization of being able to respond to future pandemics. And I don't know what the right answer is. I mean, it's something we're going to have to come to terms with and figure out as a global health community.
Mm-hmm. At the same time, though, I think COVID has shown us that a lot of our weaknesses within public health and global health are within the health system. And so, like you were mentioning with contact tracing, that's something that we should already have set up everywhere. So even if it pulls resources from some areas, in the long run, it could be a benefit overall because we're strengthening the system.
Yeah. And we're just going to have to do it. Like there's no, like pandemic, if we think about let's say, for example, we had a virus that had the sort of case fatality rate of this Nipah virus that's flapping around, that's not very infectious, but has got a case fatality rate of 60%. And you had a virus like that had the R0 of measles, which is like every case will infect 16 additional cases in a totally susceptible population. If you had a virus like that flapping around, at the moment when we're on lockdown, we've still got essential services working. We've got clean water, we've got electricity, we've got the internet, we can do Skype, we can order things online. With a serious enough pandemic, all of those things would go away. Like no one would go, like society would just start falling apart around us. The virus wouldn't kill us. After 48 hours of not having clean water coming out of your taps, people will start looking over the wall to see what their neighbor's got, and what's going to scare the crap out of them is they'll see their neighbor looking back. The point is, like, we cannot afford to, like, get to a point where, we get pandemic threats that are beyond the scope of our ability to manage them. We're just going forwards. We've got to take this seriously, and I don't know what that means in terms of resource, but whatever it is, we just have to put it in place.
Absolutely.
Cool. So
that's my little diatribe.
Yeah, no worries. And I realize it's almost time here to end this little session, but we have a few more questions. If you could answer them very briefly, that would be great. So the first one is from Zuha, and it's, can you please give insight on how to pursue management, especially if you started with the entry-level public health job? So would a PMP, a professional certification in project management, be sufficient? Or is anything like that, would that help? Very quickly, if possible.
I'll be very quick. Any certificates you can get on any of the different aspects of management will stand you in good stead. Project management's important, human resource management's important, risk management's important, performance management's important, budgets and finances. Any management certificates you can get them, and then find ways of applying them in your day-to-day life.
Cool, thank you. And one last question is from Lauren. Any tips for someone who's trying to get into global health from a background in nursing/hospital management? This individual is currently working on an MPH with a specialty in global health, and Lauren's also interested in health equity and women's health.
Okay, well, she's definitely piecing together all the right pieces of the puzzle. Firstly, she's getting the NPH, so she'll have that kind of entry-level education that's needed. When she gets into that public health space, she's got the clinical background, and that counts for a lot. There's a lot of people in global health that don't have that, so she needs to work that angle. When she applies for jobs, she needs to say, I've been at the coalface of healthcare. That's important. It'll give her a lot of insight into actual health systems, because she's really been part of the health system itself. And then the space that she's looking at, did you say gender equity, that kind of thing? Was that the...
Yeah,
Right.
health equity and women's health, yeah.
Super important area. There's loads of work there. She's not going to struggle whatsoever.
Awesome.
You hear that,
So-
Lauren?
You're in the right place there. So thanks again for lending us your time. I would imagine a lot of people benefited from hearing about your journey and your expertise, and I did as well. So thanks again for coming. I would like to give you an opportunity as well for any final words around the topics we've been discussing today, even anything, words of motivation or insight that you have that you want to leave us with, as well as you do some great work as well in communicating about a lot of these topics on your YouTube channel. And I think learnmore365.com is your website, where you also have courses for people who wanted to learn about those various aspects of public health and global health. So I'll pass it on over to you, and you can take it however you will.
Okay. Well, firstly, thanks very much for having me here. This has been a lot of fun. I've loved this. I'll come back anytime you guys ask me. This was terrific. Just one thing I'll say to people that are interested in working in the global health space or the public health space is this. You will be saving lives. So when you get up in the morning, you're having a bad day, you're tired, you know, your work has been feeling a little bit dull, you're saving lives. You just don't know who those lives are, because when public health works, it translates into things that don't happen. People that don't get exposed, people that don't get sick, people that don't land up in the hospital, putting pressure on the acute hospital system. So the work you're doing is saving lives. You just don't know who those lives are. Those people don't know that you've saved their lives, and so they don't know to thank you. So in a lot of ways, that thank you process doesn't happen, and it's easy to feel a bit disheartened, like this is just a job, and get into the rut of it. But don't just keep in the back of your mind there are people alive today that wouldn't be were it not for the work we're doing. And if you keep that in mind, and I keep that in the back of my mind, and I tell that to my staff and my team that I work with, and I tell it to them often, you know, you guys are saving lives. We don't know who they are. They don't know who they are, but they're alive because of the work you're doing. So let that motivate you if you can.
Absolutely. And share a bit about your how do people find some of the content that you create for those who want to learn more about
The YouTube channel. So if you go to, I think it's youtube.com/Dr. Greg Martin, DrGreg.
and we'll put a link in there as well.
I had to think about how to spell my name. So that's my YouTube channel. That's I'm on Twitter and I'm on all of the other social media places, but the place I'm most active is YouTube. So that's probably the best place to find me. And then, as you mentioned, learnmore365.com. I have some teaching content that I sell there, but I've got a public health course that's on there that's free. So the public health teaching content is free.
Absolutely. Well, thank you so much for joining us again. We'll certainly in the next, end of the year, next year at some point, invite you on. There's a lot more we wanted to discuss, but we had a really engaged audience who had a lot of questions. So we're happy that we were able to get through those. So in the future, again, we'd be happy to have you to talk about some more important public health and global health topics. So thanks again for coming.
Thanks for having me. I
This
appreciate
is
it.
amazing.
Thank you, Greg.
So before you leave,
Thank you,
Dr.
Dr.
Martin, before you leave, I'm going to stop the... Thanks, everyone, for listening. We're going to end the live recording session now.
Thank you all for tuning in.
Thanks for tuning in. You can, if there's something in this discussion that whether some resources that were referenced, feel free to message us via email, social media, and we'll get those to you. This will also be published as a recorded podcast, post-produced podcast episode at a later date in the future. So if there's anything you missed in terms of taking notes, that will be out there in archive. So don't worry about that. Thanks, everyone. Dr.
care.
Martin, we're going to keep you for a minute before you go.
Sure. Cheers, everybody.
Bye, everybody.